Women who experience menstrual bleeding, which is abnormally heavy or prolonged, can't maintain their usual activities. The blood loss and cramping interferes with their physical, social, and emotional quality of life. Dr. Anya Rose, an OB/GYN at Methodist Hospital in Arcadia, tells us what she sees in her practice.
Women who have heavy menstrual bleeding often state that their bleeding is more than a pad an hour. They're soaking through their clothes or having accidents, passing clots. It's quite miserable for women who have heavy periods. It could start at any time in their reproductive age. Could be in their 20s, 30s, 40s. But a lot of women most times find that it's in their 40s where it starts to become bothersome.
There are many possible causes for heavy menstrual bleeding.
Most commonly it's fibroids, which are benign growths within the uterus. Sometimes it's adenomyosis, which is another problem that can occur where the lining inside the uterus grows into the muscle of the uterus. It could be some hormonal imbalance problems. Could be a concern for potential cancer. Could be a bleeding disorder, or other medications can cause heavy period bleeding as well.
Dr. Rose outlines the possible treatments.
There's medication options and there's surgical options. Medication options typically start with either a hormonal option, such as birth control pills, hormonal contraceptives, such as IUDs, or other non-hormonal medications, anti-inflammatory medications, also help with heavy bleeding. Then when we move to the surgical options, there's a lot of non-invasive surgical methods for heavy menstrual bleeding, which is great because it helps to avoid hysterectomy in women these days. A long time ago, used to be hysterectomy was the main option, and that's what most women had done. But now we have a lot more options for women instead of proceeding with major hysterectomy surgeries. About 90–95% of the time, we can just use either medication or minimally invasive surgeries to help with the bleeding problem. And of course, hysterectomy is 100% curative because there's no more uterus to bleed from.
Women who delay getting this condition resolved can develop other problems.
We put things off. We're always taking care of our family, taking care of our kids, and so we just say, oh, I'll deal with it next month I'll deal with it. And so the longer the problem continues without treatment, anemia can set in. Sometimes you need blood transfusions. Sometimes you end up passing out because you get so weak and anemic, and that becomes dangerous. Do not ignore it. Take care of it. There are many options. Sometimes women are just fearful. They don't want to go with hysterectomy, which is very understandable. But there are many options out there that we can help with.